Pimozide, brand name Orap, is a typical antipsychotic that is used to treat Tourette syndrome, a neurological disorder characterized by repetitive, involuntary movements and vocalizations, tics. Pimozide is a type of antipsychotic medication that works by affecting the levels of certain chemicals in the brain, including dopamine. The starting dose of Pimozide typically ranges from 1 to 2 mg per day, taken in divided doses. The maximum dose can vary depending on the individual, but it is generally around 10 mg per day. The use of this medication should be closely monitored by a healthcare provider, as it may cause side effects such as drowsiness, muscle stiffness, tremors, and changes in blood pressure. There are certain contraindications for using Pimozide, such as a history of liver or kidney disease, a history of low white blood cell counts, and a history of bone marrow problems. Additionally, this medication may interact with other medications, such as antidepressants or anticonvulsants, so it is important to inform your healthcare provider of any other medications you are taking. Some of the laboratory tests that may be needed before starting the antipsychotic include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. Pimozide also carries a black box warning, which is the most serious type of warning that the FDA can require. The warning states that Pimozide may cause prolongation of the QT interval, a measure of electrical activity in the heart. This can increase the risk of serious heart problems, including sudden death, especially in patients with a history of heart problems. As a result, the use of this medication should be closely monitored, especially in patients with a history of heart problems. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with Pimozide.